illnesses, such as COVID-19. These facilities are congregate settings that house seniors, those usually 65 and older, and those with chronic medical conditions such as heart disease, lung disease such as chronic obstructive pulmonary disease, and those make residents more susceptible to infection from this very contagious respiratory virus. COVID-19 has significantly impacted long-term care facilities across the United States and around the world. Facilities in states very near us that have had significant rates of COVID-19, such as New York and New Jersey and Maryland, in New England, Massachusetts, Rhode Island, and the Midwest and Illinois. When COVID-19 first appeared, we recognized that this virus could easily spread in nursing homes and other congregate facilities. We instituted guidelines provided by the CDC early in March when the first cases were detected in Pennsylvania, including limiting outside individuals, visitors, from entering long-term care facilities. Recent studies have shown that when there is an increase in cases in a county and community spread of COVID-19, there is a direct impact on the long-term care facilities in that area. This impact is especially evident in counties where there is more population density and widespread community transmission of COVID-19. We know that many individuals with COVID-19 can be asymptomatic, but yet very contagious. And that's how brave and courageous staff members who have dedicated their lives for caring for these vulnerable Pennsylvanians unknowingly spread COVID-19 into these facilities. It's important to remember that for most residents of long-term care facilities, this is their home. Therefore, following federal guidance from the Center for Medicare and Medicaid Services, if a resident has tested positive for COVID-19 at a facility and then required hospitalization because of their symptoms, when they recovered, they were returned home to their facility. It's important to understand that this did not bring new cases of COVID-19 into the facility because that's where the resident initially came in contact with the virus in the first place. When they got home, these residents were once again separated from others who were believed not to have COVID-19, just as they had been before they required hospital care. Many long-term care facilities in our Commonwealth have successfully prevented COVID-19 from becoming widespread following our protocols and CDC and CMS's protocols. But unfortunately, in some, COVID-19 has been much harder to contain. Whenever a long-term care facility in Pennsylvania reports a single case of COVID-19, we consider that to be essentially an outbreak. We do a variety of assessments in that situation and offer up numerous resources. This includes working with our infection control team and making additional resources available, such as our infection control consultants, ECRI, or in cases where there are severe staffing issues, deploying the Pennsylvania National Guard as essentially a strike team to assist those facilities.
Team,
now, we have had instances where
people.
Facilities with COVID infections have actually turned down these services, even though we felt it would be beneficial.